Are you expecting a baby but feeling like something is different? Maybe your belly is growing faster than expected, or you're feeling extra tired and queasy. Could there be more to it than meets the eye? There are subtle hints your body gives early on that might suggest you're carrying twins. From an unusually high hormone level to that first ultrasound surprise, there are signs you may be growing two little ones instead of one. What are these clues and how can you tell? Let's take a look at the early signs that could mean twins are on the way. Number 1. Rapid weight gain. One of the early signs of a twin pregnancy is rapid weight gain, which tends to happen more quickly than in a singleton pregnancy. This is because your body needs extra resources to support the growth of two babies. The increase in blood volume, amniotic fluid, and a larger placenta all contribute to the added weight. Women carrying twins often notice this weight gain as early as the first trimester. It's important to remember that while weight gain is expected, the amount can vary depending on factors like your pre-pregnancy weight and body type. Additionally, a twin pregnancy usually leads to more frequent hunger due to the higher energy demands. Doctors typically recommend a higher calorie intake to nourish both babies adequately. Regular prenatal checkups will help ensure that weight gain is healthy and on track for the pregnancy stage. However, excessive weight gain could also be a sign of other complications like gestational diabetes, so it's important to monitor this with your healthcare provider. Number 2. Extreme morning sickness. Extreme morning sickness, also known as hyperemesis gravidarum, is a common early sign of a twin pregnancy. While many women experience nausea and vomiting in the first trimester, those carrying twins often report more intense and prolonged symptoms. This is largely due to higher levels of hormones like human chorionic gonadotropin and estrogen, which are significantly elevated in twin pregnancies. These hormones can intensify the feelings of nausea and cause more frequent vomiting. Morning sickness in twin pregnancies may start earlier and last longer, sometimes extending into the second trimester. For some women, the nausea can be so severe that it interferes with their daily activities and requires medical attention. In extreme cases, hospitalization may be needed for intravenous fluids and nutrients to manage dehydration and ensure proper nutrition for both the mother and the babies. Managing morning sickness in a twin pregnancy often involves a combination of dietary adjustments, staying hydrated, and taking prescribed anti-nausea and nausea medications under a doctor's guidance. Number 3. Higher HCG levels. Human chorionic gonadotropin HCG is a hormone produced during pregnancy, and its levels are typically higher in twin pregnancies than in singleton pregnancies. This hormone supports the development of the placenta and ensures the growing babies receive enough nutrients. In twin pregnancies, the body produces more HCG to meet the increased demands of two embryos. Higher HCG levels are usually detected through blood or urine tests during the first few weeks of pregnancy. These elevated levels can sometimes indicate the presence of twins, though they are not conclusive on their own. Other factors like molar pregnancies or certain health conditions can also cause increased HCG. Women with higher HCG levels often experience more intense pregnancy symptoms, such as heightened nausea, morning sickness, and fatigue. While elevated HCG can be an early sign of twins, an ultrasound is the only reliable way to confirm the presence of two babies. Monitoring HCG levels helps doctors assess the health and progression of the pregnancy. Number 4. Severe fatigue. Severe fatigue is a common early sign of a twin pregnancy, often more intense than in a singleton pregnancy. This extreme tiredness is due to the body working harder to support two developing babies. With a higher metabolic demand, increased blood flow, and rising hormone levels, especially progesterone energy levels, can quickly deplete, leading to overwhelming fatigue. Carrying twins places extra strain on the body, requiring more nutrients and oxygen to nourish the babies. As a result, mothers of twins may feel exhausted even after minimal activity. This fatigue can start as early as the first trimester and may persist throughout the pregnancy. Managing severe fatigue involves prioritizing rest, eating a balanced diet rich in iron and protein, and staying hydrated. It's also important to listen to your body and avoid overexertion. If fatigue becomes extreme or is accompanied by other symptoms, it's essential to consult with a healthcare provider. Number 5. Early fetal movement. Early fetal movement, also known as quickening, may be more noticeable and happen sooner in twin pregnancies. Typically, women carrying twins feel these movements around 16 to 18 weeks of pregnancy, though some may detect them as early as 15 weeks. The increased number of movements is due to the presence of two babies, both becoming active in the womb. In a singleton pregnancy, fetal movements often start later and may feel lighter at first. However, with twins, the movement can feel more frequent and pronounced as both babies move and shift positions. Some women describe feeling movements in different areas of the abdomen at the same time, as the babies occupy different spaces. It's important to note that feeling early fetal movement can vary from person to person, depending on factors like body type and whether it's a first pregnancy. Regular movement is a positive sign, but if the patterns change significantly, it's advisable to consult a healthcare provider to ensure everything is progressing normally. Number 6. Larger uterus for gestational age. A larger than expected uterus for gestational age is a common early indicator of a twin pregnancy. During routine prenatal visits, doctors measure the size of the uterus fundal height to track the baby's growth. In a twin pregnancy, the uterus expands more quickly to accommodate two growing babies, often measuring larger than expected for the number of weeks into the pregnancy. This rapid growth can be noticeable as early as the first trimester, with many women showing a visible bump earlier than those carrying one baby. The increased size of the uterus is due to the need for more space, amniotic fluid, and a larger placenta to support both fetuses. However, a larger uterus doesn't definitively confirm twins, as other factors such as incorrect dating, excess amniotic fluid, or maternal body type can also influence size. To confirm a twin pregnancy, an ultrasound is required. Early monitoring of uterine growth helps healthcare providers detect potential complications like preterm labor or gestational diabetes. Number 7. Early ultrasound detection. The most reliable early sign of a twin pregnancy is an ultrasound, typically conducted around 6 to 10 weeks. During this scan, the technician can often detect the presence of two gestational sacs, two embryos, or two heartbeats. In some cases, a twin pregnancy is discovered earlier than planned if a woman has an early scan to confirm pregnancy or investigate symptoms like severe morning sickness or rapid weight gain. Ultrasounds are highly accurate and can confirm whether a pregnancy involves twins, as well as determine whether the twins are identical monozygotic or fraternal dizygotic. Identical twins share a placenta, while fraternal twins each have their own. This distinction is important because twin pregnancies, especially identical twins, may require closer monitoring to prevent complications like twin-to-twin transfusion syndrome. Early detection allows doctors to create a specialized prenatal care plan to manage the higher risks associated with twin pregnancies, such as preterm birth, gestational diabetes, and preeclampsia, ensuring the best outcomes for both mother and babies. Thanks for watching, and don't forget to like, share, and subscribe.